Thanks, Chair. And I would also like to congratulate the independent group in relation to this motion. It's quite wide-ranging, and obviously we'd like to see all that being implemented as soon as possible. And Minister, I think what the pandemic showed us many, many things about our health service, about our country, about ourselves, the collective spirit in relation to that time. It was a very, very dark time in our history, but it was a collective effort in relation to looking after each other and so forth in our public service. And obviously the frontline workers were up against something that was unprecedented in the history of any health service in the last 100 years. And, you know, there was a huge sacrifice being made. But I think collectively we came out of that in a better way in some ways. But there was huge inequalities kind of showed in relation to private and public healthcare, and in relation to the historical legacies of capacity in Ireland. Over the last 30, 40 years, there's been thousands of beds taken out of the public health service, and we're kind of, we're living with that kind of capacity issue today. And I know there's a lot of debate around universal healthcare, and I think the majority of people in this country would support universal healthcare. Such as, I mean, a good example is the NHS in Britain. Not perfect by any means, but a much better system than we have here at the moment. I mean, 50% of people in Ireland still rely on private health insurance. I mean, that's not the fault of them people, but obviously they think that, you know, we'd have a better chance around private healthcare, accessing, you know, healthcare rather than the public system. And that has to be addressed, because they are historical inequalities that lead to really bad outcomes for a lot of people. Just finally, in relation to retention and retention and recruitment, this is the most important issue of our time in relation to keeping staff in this country around crisis of housing, and we need to keep staff here rather than have to go abroad. Thank you.